In this video, we will discuss about hygiene. We also look about different types of hygiene and importance of hygiene in our daily routine. Now first look at basic definition of hygiene. According to World Health Organization, hygiene refers to conditions and practices that help to maintain health and prevent the spread of diseases. Apart from this, personal hygiene is maintaining the body's necessary cleanliness. There are different types of personal hygiene, including washing your face, hands, cutting nail, brushing teeth, etc. These all are the basic things we know. Now let's dive deeper. There is a hypothesis related to personal care, and this is called as the hygiene hypothesis. This hypothesis relies on the assumption that humans have adopted to a pathogenic environment that no longer exists in industrialized societies. Next, we look at explanation behind this hypothesis. In the light of the hygiene hypothesis, as living environment is improved, children become less exposed to infectious agents, which leads to inadequate maturation of their immune systems. This hypothesis was initially stated by Strachan back in 1989. Now let's discuss about some types of hygiene and their role in a healthy living individual. Hygiene is divided into these categories based on different activities. These are home and everyday hygiene, personal hygiene, medical hygiene, sleep hygiene, and food hygiene. First, we have personal hygiene. Home hygiene is interconnected with general household, hand, and food hygiene. General household hygiene, in this context, refers to maintenance of hygiene of the surroundings, the environment, such as surfaces commonly touched by hands, to be disinfected regularly. In household waste disposal, all waste should be placed in a suitable container with a close-fitting lid, or tightly fitting lids for bins placed in the open areas. After home hygiene, let's look at personal hygiene. This hygiene includes bathing, skin care, hair care, and oral hygiene. We will first look at the early history of hygiene and compare them with modernized ways of hygiene and personal care. Early bathing includes plumbed baths. Back in 1700 BC, plumbed baths were made in bathrooms which supplied water through terracotta pipes. With advancement in hygiene in 1600s, dry cleaning of underclothing came first in England. This improves ways of personal hygiene. In early eras for skin care, the first cold cream was made by Greeks back in 200 BC with beeswax and rose oil. Now back in 1900s, cosmetic companies began to launch skincare products of different ranges. Next, let's look at hair hygiene. Early high hygiene includes Egypt oil wigs and shaving, while today specialized shampoos and conditioners are developed.